Hello everyone. So today we'll be discussing anatomical nomenclature. And this topic is very crucial because in order to communicate effectively as a clinician, you need to be conversant with your anatomical nomenclature. And so we're going to discuss this briefly. So this is the anterior view or the front view of the human body. Okay, so you can see some terminologies that have been used. So head is referred to as cephalic in anatomy. Okay, neck is referred to as cervical. The armpit is referred to as axillary. Okay, I mean the arm is the common word that the layman is going to use, but anatomists will prefer, or clinicians will prefer to use the brachial. Okay, in front of the elbow is antecubital. Then the forearm is called the antebrachial. Then the wrist is called the carpal. Okay, where we have the carpal bones. Okay, fingers referred to as the digit or phalangeal or the phalanx. Okay, the foot is pedal. Okay, the leg is crural. Ankle is tarsal. Okay, the pubis is around the pubic area. Hand is manus or manual. Groin is inguinal. Okay, navel is umbilical. Breast is mammillary. Breastbone is sternal. Okay, and what have you. So this is the posterior view, or this is the back view of this cartoon. Okay, you can see the base of the skull, which is referred to as occipital. Okay, the shoulder is referred to as the acromial, okay, or acromion. Then the shoulder blade is referred to as the scapula. The spinal column referred to as the vertebral. Okay, back of the elbow, olecranon. Okay, the in between the hips we have the sacral region. Buttocks is called the gluteal region. Okay, popliteal is behind the knee. Calf is called sural. Then the sole of the foot is called the plantar. Okay, so these are various terms that anatomists usually use, and when you are communicating with maybe your consultant or your specialist, these are some of the terms that you need to use in describing an x-ray or a CT scan or an MRI. So we'll look at some anatomical directional terms. Okay, we'll look at the medial versus lateral. So we'll pick the anatomical body in the anatomical position, then we'll look at what is medial, what is lateral. We'll look at superior, we'll look at inferior with examples. We'll look at anterior, we'll look at posterior, we'll look at proximal versus distal. We'll look at superficial versus deep. Then we'll look at unilateral versus bilateral. We'll look at ipsilateral versus contralateral. Okay, so this is something that you need to know. Okay, as far as anatomy is concerned, you need to know this, and you're going to carry this for the rest of your life. It's called the anatomical position. Anatomical position. Okay, this is what the anatomical position says, that you should be standing upright. Okay, so you can see in this cartoon this man is standing upright. See, the head and the eyes are directed straight ahead. Okay, straight ahead, the head and the eyes, so they are not turned to the side, turned to the left or turned to the right. It's in the neutral position. Then the upper limbs are the sides, so you can see this is the upper limb. Both of the upper limbs are on the side, not that one is on the shoulder or the other is on the shoulder or behind your back. It's close to your sides or at your sides. Then the upper limbs slightly away from the trunk. So see, the limbs are slightly away from this is the trunk. Okay, this whole place is the trunk. Your upper limb is slightly away from the trunk. So you see there's this angle. There's this angle. So because it's away from the trunk, it creates an angle. Then the palms are facing forwards. So this is a palm. This is a palm is facing forwards. Not that the palm is facing backwards. The palm is facing forwards. Okay, and the thumbs are pointing away from the body. So this is the thumb. It's pointing away from this whole body. The thumb is away from this whole body. The lower limbs are parallel. Okay, so these are parallel. One here, the other here. Then the feet flat on the ground and facing forward. So you can see the feet is flat on the ground. Alright, so this is the anatomical position. Again, for the anatomical position, you're standing upright. Once you're standing upright, your upper limbs slightly away from the trunk. This is the trunk. Upper limb slightly away from the trunk such that it creates an angle. This one is away from the trunk. Okay, the upper limbs are also on the sides, not behind your back. They are on the sides. The palm is facing forwards. The thumb is away from the body. Okay, the lower limbs are parallel to each other, and then the feet is flat on the ground. So this is the anatomical position. So we'll look at some anatomical directions. Okay, we'll look at superior versus inferior, we'll look at anterior versus posterior, we'll look at dorsal versus ventral, we'll look at proximal versus distal, then we'll look at medial versus lateral. All right, so all these are anatomical directions that we're going to look at. So this is the first one. We'll look at medial versus lateral, or medial and lateral. Okay, so whenever you are describing medial and lateral, once again you can see that this cartoon is in the anatomical position. Okay, the cartoon is standing upright, the face is in the neutral position, the head and the eyes are in the neutral position, not towards one side. You can see that the lower limbs are away from the trunk, away from the body. Okay, it's creating an angle. The thumbs are away from the body, the palm is facing forwards. Okay, the lower limbs are parallel to each other, and then the feet is flat on the ground. Okay, now in describing medial and lateral positions, we need a reference point. Now your reference point is this imaginary line, okay, or this midline, which divides the body into two equal halves. Okay, now any structure that is towards the midline is medial. So you can see the red arrow is moving towards this direction. So any structure which is more towards the midline, this blue structure here, this blue line here, is medial. Now any structure away from the midline is lateral. Okay, so any structure towards the midline is medial, any structure away from the midline is lateral. Okay, so we're going to look at examples. Okay, again, this cartoon is in anatomical position, head facing forward. Okay, eyes in a neutral position, lower limbs away from the body, thumb away from the body. The upper limb is slightly away from the trunk, thumbs away from the body, lower limbs okay close to each other. Okay, and then the feet is flat on the ground. I said that for medial structures, the medial structure is when it is towards this imaginary midline. Okay, once it's more towards this midline, then it's medial. Once it's away from the midline, then it's lateral. Okay, so we'll look at some few examples. So in describing medial and lateral, we can look at this region. So this is the lungs. These two structures are the lungs, and in the middle is the heart. Okay, so we say the lungs are lateral to the heart. So because the lung is more away from the midline, so we say you can draw a midline. Okay, because the heart is more in the midline, so the heart is medial to the lungs. But because the lung is a bit away from the midline, then the lungs are lateral to the heart. Okay, so again we said that the reference is the midline. So the structure in the midline is the heart. So we are comparing the heart and the lungs. Okay, so in comparing the heart and the heart is more towards the midline than the lungs. The lungs is more away from the midline than the heart. And so in describing it, you say the lungs are lateral to the heart, whilst the heart is medial to the lungs. Okay. Then another example, we can use the eyes and the nose. Okay, you can see that the nose, so if we are drawing an imaginary line, this is the midline here. Okay, this is the midline, this is our reference line. You notice that the nose is just in the midline. Okay, so that is more close to the midline than the eyes. So in describing or comparing the eyes and the nose, we see that the nose, okay, we say the nose is medial to the eye. Then we say the eye is lateral to the nose because the eye is more away from the midline, right? Then we'll look at another directional term. We'll look at superior and inferior. Superior and inferior. Okay, superior means that anything above. So now here, you see, still in the anatomical position here, the reference point is the head. So any structure that is moving towards the head, or any structure that is more towards the head, is superior. Okay, any structure that is more away from the head is inferior. Okay, so superior means anything above, inferior means anything below. Okay, as simple as that. So we'll look at some few examples to appreciate what we are saying. So we are still comparing the eye and the nose. The eye and the nose. Here we said that superior means that anything that is more close to the head. Inferior means that anything that is more away from the head. So in comparing the eye and the nose, the eye is more towards the head than the nose. So we say the nose is superior to the eye, but the nose is inferior to the eye because the nose is more further, or is away from the head. So the eye is superior to the nose, and the nose is inferior to the eye. Okay, so this is another example, still talking about superior and inferior. We will use the heart and the liver as an example. So we are comparing the heart and the liver. We notice that the heart is more towards the head, or is more above than the liver. So we say the heart is superior to the liver, and the liver is inferior to the heart. The heart is superior to the liver is inferior to the heart. Very simple. Then we'll look at anterior and posterior anatomical directional terms. Okay, anterior and posterior. Anterior simply means that is the front side or the front view, okay, towards the front of the body. So anterior part is the front view. Anterior is also known as ventral. Anterior is also known as ventral. Okay, so towards the front or the frontal view is usually called anterior. The back view is usually called posterior. Posterior is also called dorsal. Posterior is also called dorsal. Right? So then again, we'll look at examples. So the frontal lobe is anterior to the occipital lobe. So this is the brain. Okay, these are the lobes: frontal lobe, parietal lobe, temporal lobe, and this lobe here is called the occipital lobe. This is the occipital lobe. This is the cerebellum. This is the occipital lobe. So we are comparing this lobe and this lobe, this lobe and this lobe. Okay, this is the face. So you can see that this lobe is more close to the face, and the face is the front part of the body. And so we say the frontal lobe is anterior to the occipital lobe. You can see that this is towards the back. So we say the occipital lobe is posterior to the frontal lobe. As simple as that. Okay, frontal lobe is anterior to the occipital lobe. Occipital lobe is posterior to the frontal lobe. Then we'll look at another directional term. We'll look at proximal and distal. Proximal and distal. Okay, proximal means that it is towards the trunk. So this is the trunk or your torso. This is your trunk, or near the origin. Okay, so proximal simply means proximity. Okay. Then distal means it is away. So distal means like a distance. When we say distal, it's more like a distance. You are so distant. That's where the word comes from, distal. So you are away from the trunk. Okay, you are far away from the origin. So some few examples. So we'll look at the wrist. We'll compare the wrist and the hand. So this is the wrist and the hand. Okay, we notice that in comparing the wrist and the hand, we notice that the one that is farthest away, okay, is the hand. So in comparing the wrist and the hand, we say that the wrist, okay, the wrist is proximal to the hand because this is the hand is farthest away, and then the wrist is more close relatively. Okay, so we say that the wrist is proximal to the hand, but the hand is distal to the wrist. The hand is distal to the wrist, but the wrist is proximal to the hand. Then we can compare the elbow and the wrist. Okay, so this is the wrist, this is the elbow. In comparing the wrist and the elbow, we see that the wrist is further away from the elbow. The wrist is further away from the elbow. So we say that the elbow is proximal to the wrist. Okay, and the wrist is distal to the elbow. But when we're comparing the wrist and the hand, we said that the wrist is proximal to the hand, and the hand was distal to the wrist. But now we are comparing the wrist and the elbow. Okay, and we notice that the elbow is more closer to the trunk, which is this side. So because this is more closer to the trunk, then we say this is more proximal. So in comparing the elbow and the wrist, we say that the elbow is proximal to the wrist. Alright, then this is the elbow, this is the shoulder. Okay, this is elbow, this is shoulder. The shoulder is more close to the trunk here, so the shoulder is more proximal than the elbow. So we say that the shoulder is proximal to the elbow, and the elbow is distal to the shoulder. Okay, so the same thing here, the ankle is proximal to the foot. Okay, so this is the ankle, this is the foot. The ankle is proximal to the foot because that's more closest to the trunk. So the ankle is proximal to the foot. The same way the knee is proximal to the ankle, the same way the hip is proximal to the Then we use another term, superficial and deep. Superficial and deep. We can say superficialis or profundus. Okay. Now, when we say superficial, it means that it is closer to the surface of the body. So here, the surface of the body is actually the reference point, or your skin. Okay, your skin or the surface of the body. Okay, any structure that is closer to the surface of the body is superficial. All right. So we'll use examples to help us appreciate what we are saying. So when we are comparing the skin and the ribs, we know that we encounter the skin before the ribs, and the skin is more superficial, okay, to the ribs. You need to go deep before you encounter the ribs. Okay, so in comparing the skin and the ribs, the skin is superficial to the ribs. However, if we are comparing the ribs and the lungs, okay, once you go through the skin, you encounter the ribs before you encounter the lungs. Okay, so we notice that the skin is more closer to the surface than the lungs, and so the ribs are superficial to the lungs. Okay, the ribs is more closer to the superficial to the surface of the body than the lungs, and so we say the ribs are superficial to the lungs. All right. Now, in using the word deep, okay, let's compare lungs and then tissue and then ribs, because the ribs is superficial to to the lungs. The reverse is true. The lungs are deep to the ribs. Okay, then the ribs are deep to the skin. It's as simple as that. It's as simple as that. Okay, again, the skin is superficial to the ribs because you encounter the skin before you encounter the ribs. The skin is closer to the surface of the body. Now, in comparing the ribs and then the lungs, okay, the ribs are more closer to the superficial surface than the lungs. Now, in using the term deep, the lungs is more deep than the ribs, okay, because the ribs is more closer to the surface of the body. Now we're going to use another term, unilateral and bilateral. Unilateral and bilateral. Uni means one, bi means two. Okay, so unilateral means that maybe there's an involvement of one side of your body. Okay, so usually for patients who have stroke, you notice that they can't move their upper limb, they can't move their lower limb. So this side, one side of the body is affected. So we say it is unilateral involvement. Okay. However, there are times when both the right and then the left side of the body will be affected. And now you can say there's bilateral involvement. Okay. It's involving both sides of the body. So the right side and then the left side. Now, another term, ipsilateral and then contralateral. It's a bit confusing, but it's very easy to understand. Ipsilateral and then contralateral. So, for example, if a patient has a brain tumor, okay, and the right part of the brain, and then there's weakness on the right side, then you say that because the tumor is on the right, because the tumor is on the left side of the brain, and then the weakness is on the right, then you say that there's contralateral weakness. There's contralateral weakness, because sometimes you expect that because the tumor is in the left side of the brain, then of course the weakness should be in the left side, but no, the weakness can be on the right side, and if it's on the right side, you say there's contralateral involvement. However, if the tumor is in the left brain and then the weakness is on the left side, which is the same side of where the tumor is, then you say it is ipsilateral. So ipsilateral means that on the same side of the body. Contralateral means that on opposite sides of the body. Okay, so we'll look at some few planes. Very important. This one too can be a bit confusing. Okay, so when you cut, so this is the brain. When you cut the brain, okay, across, okay, this is the transverse view. It's going through the brain. Okay, this is a transverse view. Now this is a frontal view. Okay, frontal view. So look at how the plane is going. Frontal view. The frontal view or the frontal plane is also called the coronal plane. Coronal plane. Then we have the mid-sagittal plane. Okay, so sagittal plane, mid-sagittal plane means that it divides the body into two equal halves. Okay, so this is the cartoon. You see this plane dividing, going this way, dividing the woman into two equal halves. This is the mid sagittal plane. Now the one going across her abdomen, okay, or below the umbilicus is the transverse view. Okay, then you can have one going this way, this is the frontal view or the coronal view. Okay, so you can have mid sagittal or parasagittal. The difference is that for mid sagittal it divides the body into two equal halves, but for parasagittal it divides the body into two unequal halves. Okay, so if you have the sagittal plane has two angles or two subtypes. You can have the mid sagittal and then parasagittal. Mid sagittal means that it divides the body into two equal halves, but parasagittal means that it divides the body into two unequal halves, right? So there's another view here for you to appreciate. So going this way is mid sagittal. Okay, going this way is the frontal or the coronal. Then across is the transverse, right? So these are fixed lines of reference along which the body is often divided or sectioned to facilitate viewing of its structures. Okay, allow one to obtain a three-dimensional perspective by studying the body from different views. Right? Now these are other positions that you need to learn, you need to appreciate. Okay, this is the prone position. So if you are lying facing downwards, okay, such that your back is facing the sky or your back is towards the sky, then we call it a prone position. Prone position. Okay, this is the supine position. If you are lying in such a way that your abdomen is towards the sky, okay, or is facing upwards, this is the supine position. Okay, then we've spoken about the unilateral and then bilateral directional terms. We've spoken about that. Say unilateral if it involves one side of the body, bilateral if it involves both sides of the body. Okay, so this is actually a scan. Okay, this is an MRI scan, magnetic resonance imaging of the brain. Okay, and it is telling you the view. Okay, so when you take various views using the MRI, okay, when you take the frontal or the coronal view, this is the frontal view, the coronal view, this is how you see it on the MRI scan. Okay, so this is the frontal view, this is the coronal view, this is how you see it on the MRI scan. So it's going towards this way, okay, across the ears, right? Now if you the plane goes in such a way that it divides the body directly into two equal halves, which we refer to as the mid sagittal, or sometimes some people call it median, mid sagittal. Okay, on MRI this is how it will look like. Okay, this is how it looks like. Okay, so the plane dividing the body into right and then left portions. Mid sagittal or median are names for plane dividing the body into two equal halves. Okay, so right and left. Then we have another plane, which is the transverse plane, okay, going towards this direction, towards the abdomen, okay, across the abdomen, sorry. The horizontal plane dividing the body into upper and lower portions, okay, also called the horizontal plane. So this is still an MRI of the brain. This is how it will look like, okay. So this is just the definition. Three-dimensional structures. Transverse plane divides the body into superior and inferior sections. Frontal plane or the coronal section or the coronal plane, it divides the body into anterior and then the posterior section. Then the sagittal plane divides the body into left and right sections. Okay, I said so when the plane divides the body into exactly two equal halves, that's mid sagittal. But parasagittal is when it divides the body into two unequal halves. Okay. So we'll look at some movements, okay, and how you describe it anatomically. Okay, so this is pronation, okay, turning the arm or foot downwards. Okay, so this is that when you turn the hand in such a way that this is the final position you have. You see that you are seeing the back of the hand, okay, the back of the hand. This is pronation, okay, the act of turning the hand in such a way that the front part becomes the back part. It's called pronation. So you turn the arm or the foot, okay, downwards. So this one is going downwards. To have this, to assume this position, it's called pronation. Okay, the reverse is called supination. Okay, when you turn, so this is a pronated arm or pronated hand. If you turn this hand upwards such that your palm is facing upwards, then it is supination. Another movement you need to know is flexion and then extension and then hyperextension. Flexion is when you bend a joint or you are decreasing the angle between two bones. So you can see, okay, if your hand is neutral, okay, so this like if your hand is straighten just like 180 degrees. Once you bend it, you reduce the 180 to like about 90 degrees. So this flexion. So this position, okay, is a flex position. This position is a flex position. Okay, when he returns his arm to the back to that position, okay, so this is a flex position. When he straightens his arm again, then means he's extending such that he is increasing the angle between the two bones. So straightening a joint or increasing the angle between two bones, okay, is extension. All right, then hyperextension, excessive extension of the parts at a joint beyond the anatomical position. Okay, so one of the questions they can ask you in your MCQ, in the anatomical position, the arms are actually extended, not flexed. True or false? Okay, you should know that in the anatomical position, okay, the arms are actually extended, not flexed. All right. So these are various movements: flexion, extension, hyperextension, adduction. Adduction means that you are moving your arm towards your trunk, or you are moving your arm towards the midline. Okay. Abduction means that you are moving your arm away from the midline. Okay. We've spoken about pronation, spoken about supination, retraction, pronation, all these ones. Um, just try and read on it. Okay. So thank you very much for your time. Kindly like, share, and subscribe to this YouTube channel. I'll see you in the next video. Bye bye.